Welcome back. This is Therapy Twins.
I'm Jane.
And I'm Joan. Today's topic is
pregnancy, breastfeeding, and psychiatric medications. Quite a controversial topic.
But thank God you've been pregnant before.
And I'll share about that in just a moment. A bit of history. Western medicine changes their mind every 10 years or so. If people are our age or a little older, you might remember a famous medication called thalidomide. That was to treat
nausea.
Morning sickness that many of us feel. Later was banned because it not only caused birth defects but miscarriages. Then there was another famous medication called DES.
Really long name.
Really long name. That prevented miscarriages and again later was found to cause birth defects. So that was banned. One medication that's not banned but banned during pregnancy is Accutane. It's a famous medication for the treatment of severe acne. That medication you have to do a lot of signing and watching videos and have two forms of birth control if you are a female, because it's not if you'll have birth defects, it's what kind of birth defects the baby will end up having.
So thank goodness in the late 70s, the FDA, I'm actually going to be nice about the FDA in this video. I think I've slammed them in previous videos. But
I believe so.
I think so. In the late 70s, early 80s, they categorized medications for women so that they would let you know from A to D, X we can talk about later, which medication is the safest. Thank goodness the prenatal vitamin is category A.
Moving back to a bit of history and Western medicine changing their minds, back in the 50s you might walk by a bar and see a lot of ladies smoking and drinking, and then if you scanned down they were pregnant because Western medicine was unaware of the potential dangers of that.
But again, the FDA came forward and did that as well. They also modeled off of Sweden, and then later India, I think, adopted our categories.
And Joan, aren't we a little bit more strict than some other countries?
Oh, we're so strict that, in a good way this time, that category C, which is, you really have to be careful because it has shown toxic effects in animal models and humans and fetuses. So if something is category A in another country, it could easily be category C in this country. So again, the United States is pretty strict about pregnancy and babies.
We want to revisit category X and then maybe mention N. Category X, there are definitely studies where there's been effects to the fetus, which may mean let's run like hell.
From that med.
And Joan, what did N mean?
Just that there haven't been any studies yet, so I actually would not take anything that's category N. Remember though, whatever you do when you find out that you're pregnant, just stay on your meds and then call us. Once you get off of your meds, all of us or none of us want to re-prescribe. High-risk pregnancy hospitals have called and told me, I agree with all the meds that she was on, put her back on all of them. I didn't feel comfortable. I asked him to put her back on, and he said no way. So therefore she went without until the very end, a category B, which is common. I want to say if, oh Jane, you had a really good point. Why would somebody stay on a med that's not category A if somebody's...
Oh, if somebody suffers from major depression, current research shows that depressed mom equals depressed baby. Psychotic mom equals either depressed or failure to thrive baby.
And anxious mom would equal anxious baby.
So it's not the worst thing to get off all medications. There's a few meds that we would want to take people off. There's a few medications we would want low doses in the first trimester or to avoid at all costs, and then put them back on second or third trimester.
For instance, in our practice, Jane, what do you do when a woman tells you she's pregnant?
If she's on a stimulant, I tell her to discontinue it. She comes right in with family members, and we talk about the benefits versus the risks of staying on the med or going off. I've had both. I've had clients that choose no medications, and we monitor them very, very carefully, and ones that do want to stay on low doses.
And usually with the antidepressants, I give them an option. It's very safe. You stay on, and what we do is the third trimester, we wean them off slowly so that the baby goes through no withdrawal. Remember, it's not a withdrawal from addictive substance, it's a withdrawal syndrome from the antidepressants. So 3rd trimester, slowly wean off. The minute you deliver, you can go right back on, because now we'll move into breast milk. Much less of the medicine will go through the breast milk.
But they do pass through onto the baby.
Pesticides, on the other hand, collect in breast tissue. So if you've ever been exposed to pesticides, obviously you wouldn't want to breastfeed. But let's talk about some other meds, not psychiatric meds, that you would end up having to stay on if you're pregnant.
Well, if the woman is extremely psychotic or severe bipolar 1 disorder, we're talking the real one, the baby, again, is at risk, like we said, of failure to thrive, depression, anxiety, etc. Haldol, the old typical antipsychotic, is the gold standard. Most babies have been born on it with the fewest amount of birth defects.
And Prozac, unfortunately, those are the 2 that most babies have been born on, with the fewest birth defects. But what I was talking about was non-psychiatric medicines. What if somebody has high blood pressure or diabetes?
They usually have no choice but to stay on those medications, and those medications, again, don't come without harm.
And then I just want to mention one med, metformin, and it's a hypoglycemic. So it's extremely important for the mom to stay on that during pregnancy, but that's a medicine that lowers your blood sugar. So it would be hypoglycemic. So then when you start breastfeeding, your baby could actually become hypoglycemic. So in that case, metformin is safer during pregnancy, but not as safe breastfeeding.
To make breastfeeding safer for those medications that the mom chooses to stay on or must stay on, you can look at each medication in terms of dosage, frequency of dosing, when is the highest blood concentration of that medication, and you can time your breastfeeding around those times so that the baby gets the least amount of exposure to that chemical.
And then the one other med that I want to mention, it's a group of medicines, and they're for acid reflux, and they're called proton pump inhibitors. Most of them are B.
Most Americans are on them.
I know, and when all you have to do is change your diet, if you have acid reflux, that's a sign, change your diet. But I know if you're Italian, you don't want to give up the red sauce. But proton pump inhibitors are category B, except for Prilosec is C. But the danger with taking those when you're pregnant is that they decrease enzyme activity in your stomach, and that then decreases your absorption of your nutrients. So what is the most important thing besides whether or not you're taking meds or not during pregnancy is...
What are you putting in your body? We already know we are what we think. We definitely are what we eat. Every obstetrician will tell a female, currently no cold cuts, low high metal fish, only twice a week.
Some say none at all.
Clearly no alcohol, no cigarettes. So let's pay attention to nutrition. You can have a very healthy baby and be unmedicated in many, many instances if you pay attention to your diet. I'm actually proof of that. When I was pregnant, I probably suffered from mild depression, chose no medication, and I did breastfeed for a bit of time, but I may have been exposed to some pesticides, clearly with factory farming. And Joan, didn't you say pesticides travels through the breast milk?
Definitely, and collects in breast tissue.
And if I had to do it all over again, I actually would choose a category C psychiatric medication to help myself go through the pregnancy and my infant during his most precious time.
So if you have any other questions about breastfeeding, pregnancy, medications, please visit the website. It's called Therapy Twins. Ask us any questions, and we will see you next time.